I'm Charlotte Winder. I am an associate veterinarian for the Kirkton Veterinary Clinic. We're a mixed animal practice in southwestern Ontario. I practice just as a bovine veterinarian and I do primarily dairy work. I love my Easi-Scan ultrasound and the clients really love it too. I use it for quite a few things, and having just been at the American Association of Bovine Practitioners Conference, I've learned some more ways that I can use it in the future. I like using it for every ovary I ever palpate. I find it really allows me to find structures a lot easier, to find CLs that are buried, to stage CLs based on fluid amount in them. And by doing this, we often set cows up differently depending on ovarian structure, and we have better conception rates based on this, I believe. It's also, of course, great for early embryonic detection of pregnancy as well. Sometimes we can find pregnancies that have something wrong with them. We may find it earlier than on palpation. It's so much easier to diagnose twin pregnancies, and my clients love that. They can manage their cows a little bit differently. They know when to do their close-up stuff because the cows are going to calve a bit earlier. They really like knowing who has twins. I have a lot of clients who are doing fetal sexing, and I actually have a few clients who, when I talked to them about fetal sexing, told me all the economic arguments against it, which I'm sure there are, but when we started doing it, I haven't had any clients stop doing it once they've started, and even clients who at first didn't think it was really economic, once we just started doing a couple because we happen to check them at the right stage, now they love it, they want to keep doing it. I find that's a really big plus, you know, depending on if something happens to that cow later in her lactation and they want to color, but maybe they'd keep her if she had a heifer. For clients that are selling heifers, it's really valuable. For clients that have cows carrying valuable pregnancies, that information is really good. So all the use in reproduction has really been amazing. Also, with the portable viewing unit, the clients really like being able to see what I'm seeing, and that's really helped. But in addition to the use in reproduction, I've used it on umbilical hernias, umbilical problems, to see maybe what we're getting into before we start opening the calf up if we're doing surgery. Just at the convention, I learned about using it to diagnose early pneumonias in calves. It's amazing how many calves have lung pathology with no clinical signs. You know, if the client misses the fever, misses the clinical signs, they could have all kinds of consolidation and they'd never know it if you just looked at the calf. So I'm going to start routinely, hopefully, in some herds, ultrasounding calf lungs. They say you can do it in less than a minute per calf, so if we can do that, that'd be really helpful. Help keep calves healthier longer, help them have more production in their first lactation. If we can do that, that would be great. We already have the equipment with the ultrasound. So in conclusion, I think ultrasounds are great. They're another pair of eyes that can see through things we can't see through, and I think the Easi-Scan is a really great product. Thanks.